With doses of the newly authorized Johnson & Johnson vaccine on the way, Texas health officials say they will be ramping up distribution this month. A member of the expert allocation panel says that they've come to the conclusion that on guidelines for the next phase, likely to be called 1C, KXAN investigator Avery Travis takes a closer look at who could be included and how it'll compare to other states.
Miss Kathy's gonna find this blue diamond and I'm gonna put it there.
At Bright Beginnings Childcare, they know all about games.
We made a game out of, the mask and how important
But these past few months, Director Patsy Harnage says it's been a waiting game.
The ones that want to get vaccinated, it's like, it seems forever.
With most of the kids' parents being essential workers, the center reopened almost immediately. So to hear Texas is now adding teachers and childcare workers like her employees to the list of people eligible for the COVID-19 vaccine,
we have a sense of hope, that we can continue our purpose now in educating the children and giving them a safe place to come and just us being safe.
They're joining healthcare workers, long-term care residents, then Texans 65 and older, and people with underlying health conditions. But compare that to these recommendations released by the CDC's Federal Advisory Committee on Immunization Practices, encouraging adding in essential workers sooner. Many states did just that, putting grocery or public transit workers in earlier phases. In Arkansas, manufacturing workers have gotten the go-ahead. North Carolina opened up access for 8 essential sectors. But top Texas immunization expert Dr. Peter Hotez says he didn't totally agree.
1A made sense, the healthcare providers and the nursing home residents, but after that, to me, they seem a bit fussy and hard to operationalize. It's unfair to ask a pharmacist to be the gatekeeper. Somebody walks in and says, I work at X. What's the pharmacist supposed to do?
He thinks saving the lives of the people most at risk and then safely opening schools should be the priority.
We're trying to be everything to everybody. We're trying to prevent hospitalizations and deaths. We're trying to interrupt transmission. We're trying to open up the economy. We're trying to open up the schools. But the harsh reality is we have to pick and choose what our areas of greatest importance are right now while those vaccines are rationed.
Overwhelmingly, those that are more severely impacted, and when I say that, I mean those that are hospitalized and those that have the most severe outcome of death.
That's how Texas health officials say they landed on the first 2 phases. In fact, the CDC later amended its guidelines to include anybody over 65 or with underlying health conditions, like in Texas.
We followed the data, and the data is where we landed with our 1B population.
Still, Texas is one of more than a dozen states that hasn't released any plan for the 1C phase. The Department of State Health Services says it all depends on supply.
We have to have a plan to save our communities. You're doing a great job.
While there's hope at Bright Beginnings, Harnage says they know how hard it is to be in the dark.
It's time to stop playing games with people's lives and get together so we can go back to normalcy.
Avery Travis, KXAN Investigates.
And keep in mind, about half of older Texans eligible under Phase 1B are still waiting for their first shots. It's a major concern for groups like AARP Texas.
I've talked to several of our members now who have reached out saying, I don't have access to the internet. I don't know where to go. I don't know who to call. I think it is the not knowing that is really causing a lot of anxiety.
AARP says it is making calls and hosting telephone town halls to ensure its older members aren't left behind.